Hi there, are you somebody who has rheumatoid arthritis and it's affecting your hips? Well, if so, this video is an exercise for you. Hi there, my name is Morgan Rysdon and I'm the creator of Center Studio, where I teach people skills to feel more comfortable more often. And friends, if you haven't already, be sure that you hit the subscribe button, you hit that notification bell, and that way anytime I make a video like this, you'll know. So today's video is based on another video that I was talking about with rheumatoid arthritis for those of you experiencing hip pain. And I created 2 additional videos with some exercises to get you started and how you could get some relief. And I want to talk specifically about the hips with regard to where they are. So I brought my skeleton today to show you. And I want to just remind everybody of where exactly their hips are. Now, if you have pain, chances are you know where it is because it's painful. But it's, again, closer to your groin than it is to the outside of your, what people call hips. On the outside of, it's actually, this is your greater trochanter. It's just the top of your thigh bone. But if you really notice, that ball and socket joint is much closer towards your center of your torso than it is to the outside. And I want you just to think about that when we're doing this exercise that I show you in upright. And the idea is that you can do this anywhere. I'm going to be talking to you a lot about the thoughts that you can have as you do this exercise. And I want you to keep in mind, anytime you take a stair, anytime you're standing in line, that you can sort of incorporate the same kinds of thoughts in any activity that you're doing. So I'm going to be standing on a stool that I have behind me, but you could use this same exercise in like your home off one of your steps, like the lowest step of a stair. You could use a step stool at your home. You could use maybe a ledge outside of your door, like if you have a front stoop or something like that. Just anywhere where you can let one of your legs hang so that the foot is you're balancing essentially on one foot, okay? So wherever you can drop that leg so that it can freely hang on either side of a step would be great. And again, I want to point out that I'm going to be talking to you a lot about the thinking that you'll have when you do this exercise. So the Alexander technique is half about thought and half about moving. We're always thinking about how we're doing things so that we don't fall into the trap of just doing something automatically and using all of the same patterns of tightening and holding that we typically do. What we really want to be mindful is, how am I doing this exercise, and am I releasing into length and width, or am I compressing and tightening the way I typically would if I just did it habitually without a lot of thought. Okay, so just make sure that you pay particular attention to where your thinking is as you do this. Okay, so the first thing you're going to do is you're going to find a step or a stool or I guess it's a step stool, and but you could have a stair at home, and you want to take one of your legs off so that it's hanging, so that you can do sort of essentially this movement with your leg. And it's pretty easy in the sense that you're just letting your leg hang, but I want you to pay attention to letting your whole weight down through whatever leg is hanging. So that could be your right or your left leg. Imagine all of that weight coming out through the bottom of the foot, out through the heel, out through the balls of the toes. The whole foot is completely free from the body. And then notice if you have any tendencies to tighten on this side, whether you're pulling in, whether you're gripping the knee, whether you're tightening at your ankle joints. And then, of course, thinking about this idea of an upward flow. In Alexander technique, we love to talk about up. The up is from the crown of your head up towards the sky or the ceiling, so that I don't fall into a pattern of this, where I'm coming down, thinking about balancing, and I'm putting one foot on the side like this, but instead I'm thinking about lengthening my spine up as I continue to allow this leg to hang on either side, okay? And then, if you want, you can change sides a couple of times, or you can do one side for a minute and then the other side. And then I want you to think about all of this weight that gravity is helping you to let the leg release away from your torso. As a reminder, your torso is anything from your pelvis or your pubic floor all the way up towards the top of your shoulders. So that's all of your torso, and your legs, my friends, are independent and they're separated at that hip joint. So imagine that that's where you're opening up that space to move. And this is the area that you're going to be moving about your day, whether you're walking, taking stairs, whether you're sitting or standing. You want to think about this movement of the hip joint always being open and available so that you can move easier on it. Because again, the tendency is to tighten. to compress. But if you're experiencing pain, you've got a lot of inflammation there, you have a lot of holding already. So you really want to give that as much space, as much room as possible whenever you can. So it starts with a little bit of thought, then you take it into a little bit of movement, and then you practice. You rinse and repeat, and you practice it in all different kinds of environments, okay? So I would love if you would share, like, and you can even comment below. And until next time, take care. Ciao.